My name is Ashley Himes, and I'm presenting about communication and physical therapy. So, physical therapist is a multidisciplinary team, so they all work together for one patient. So this includes a physical therapist, a physical therapy assistant, a physician, a patient, and an athletic trainer. So the first thing is a physical therapist is a 3-year doctorate degree who is responsible for initial evaluations and supervision of physical therapy assistants, supervision of patient care techs, and supervision of athletic trainers. And a physical therapy assistant is a 2-year associate's degree, which are supervised by a physical therapist, and they work on rehabilitation with patients and supervise patient care techs. The first communication is communication from a physician and a physical therapist. So once there's an injury, the patient will go to a physician. The physician will do initial evaluation and determine if the patient is needed for rehabilitation. Not all facilities require referral to do physical therapy, but majority of them do. And then once the patient is doing rehabilitation, then the physical therapist and the physician will talk about the patient to make sure they are doing the best for the patient for rehabilitation. The next communication is communication with the physical therapist and the patient. So once the patient comes for rehab, the physical therapist will do initial evaluation. This will include range of motion, strength, manual muscle tests, and then functional capabilities and activities of daily living. They will talk about what is the goal at the end of rehabilitation, what do they want to achieve, and what do they want to get out of it. And then, so they'll set goals, and they'll set goals weekly. So if the patient struggles with range of motion and the normal is 135, but they only can get 35, then their next goal for the next visit will be, I will gain 5 degrees range of motion by our next visit. The next communication is communication with the physical therapist and a physical therapy assistant. So every physical therapist has 4 physical therapy assistants that they supervise. And the physical therapist only sees the patient on the initial eval and then every 9 visits. So in between those 9 visits, the physical therapy assistant actually sees the patient. So it's really important for the physical therapist and the physical therapy assistant to talk about the patient. So after the initial eval, the physical therapist and physical therapy assistant will sit down together and talk about what they found out in the results of the initial eval. So they'll talk about what their range of motion is, what their strength was, what their activity of daily living that they struggle with, and their functional capabilities. And then they will create a plan for that rehabilitation for that patient and determine what the best plan is and set goals. And then they communicate daily on any changes or progress that the patient is making to make sure this is the best rehab plan for them. The next communication is communication between a physical therapist and a patient care tech. So a patient care tech is actually not certified. They're usually a high school student or a college student who are working for a degree. And they work under full supervision of a physical therapist or a physical therapy assistant once they're working with the patient. So if they're doing any help with the patient, they always have to be supervised, and they help provide any assistance with patients as needed. So that might be if the physical therapist needs an ice pack, they can go grab it for the patient. Or if they need to take the patient off electric stimulation, they can go do that. Otherwise, they can usually clean in between every patient, and they don't need to be supervised during cleaning. So the next communication is communication between a physical therapist and an athletic trainer. So if the patient is an athlete, they usually also have an athletic trainer, but they communicate with progress and expectation goals for the week. So if the patient is actually doing rehabilitation with the physical therapist and the athletic trainer stay communicating so then that way they know how their athlete is doing with rehabilitation and what their expectations are and how long they will take before rehab. And then once they are cleared from the physical therapist or physician, they can start the return to play protocol done by the athletic trainer before they can actually return to play for their sport. So an example would be a patient with a grade 1 ankle sprain. So if a patient is injured, they'll go see the physician. The physician will actually do an initial evaluation to determine if they need rehab, which this patient will, so they'll end up being referred to a physical therapist. The physical therapist will then do initial evaluation for the patient, determine what the rehab plan is, and then sit down with the physical therapy assistant and talk about the rehab plan. And then once they are getting close to being returned to play protocol, they will talk with the athletic trainer and communicate about the patient. So in conclusion, communication is very important to make sure every patient is in the best quality of care.